Esketamine nasal sprays used together with an antidepressant taken by mouth to treat patients with depression who have previously received at least 2 antidepressant treatments that did not work well. Omar is an ambitious 26-year-old who loves his job and is very distinguished and always strives for the best, and his manager appreciates him greatly. One day, the director summoned Omar to tell him that a person had been appointed on his behalf more than he had experience. Omar felt frustrated and lost hope in everything. Only then did he feel that he had no desire for anything, and that his outlook on life changed and was sad, because he received the news suddenly and unexpectedly after he devoted all his time to his work. I don't want to talk.
Omar, where are you? Why don't answer the calls?
The manager has asked me to resign. Someone who is better than my capabilities has been appointed.
Why did something like this happen?
This thing that bothered me was that I did not shorten my work. On the contrary, I saved the company with a half-cost project and it was successful. Wow! But there is a friend of the director. I think that his son was appointed in my place.
Lord Jane, I am very angry that Omar does not answer my calls, and when he answers, he starts screaming. Since he left work, his personality has changed. He becomes an introvert, he does not go out of his room. Cool off, Amira. I think that Omar is sad. Leave him for a while and return as before. I do not think so. I notice that the situation is getting worse, that it has become a strange person, as if I do not know Omar. You should try to meet him. I suggest you go out for a walk together. Long time past we didn't talk.
I don't want to talk to anyone. I don't want to go out of the house or see anyone.
You do not look at yourself, your personality has changed, you lost weight, and you love to sit alone and your mood changes constantly. I am tired of you. Omar woke up. Your family worries about you.
I am a failure and I have no taste for my life. I feel lonely, I do not sleep. I have no appetite to eat or desire to speak. I have become a nervous person and I have a tendency to loneliness and isolation and a desire to cry. I lost my friends and nobody even accepted my mood swings, even his childhood companions. Amira, Lo Jane.
I miss you so much, my love, Amira.
I am more dear Rula.
You wanted to talk to me about an important topic that worried me about your call.
Really, I was unable to solve a certain issue, and no one can help me but you. We know that you have completed your studies in psychiatry, and you have your own clinic. My friend Omar was very attached to his work and devoted all his time to him, and he reached a high level of ambition and promotion, but a person was chosen in his place, not better than him, but his father is a friend of the director, and 2 months ago, Omar did not return as his personality changed and became nervous.
I got it. He can't help Omar before I meet him. Select the right time and I am waiting for you.
Amira, we have talked about it before. I told you that I am not a psychopath and see a doctor.
As if you do not see yourself for any stage you have reached. If you do not accompany me in the morning to the clinic, I will never talk to you.
How are you, Omar? It seems that you are very close to his Amira, and the proof is that she thinks what to do to get back to your senses.
The whole story is that I don't want to talk to anyone. Omar was not convinced of his condition and insisted that he did not feel anything, but the doctor analyzed his condition and knew that it was symptoms of severe depression and dispensed him a specific medicine and asked Omar that if he wanted to talk to someone. She was waiting for him to listen to his speech.
Tell me, has Omar improved?
Praise be to God, he started treatment, and I felt for a moment that he was improving, but his condition returned to resent.
He visited me, but was cut off at the last. Duloxetine, sold under the brand name Cymbalta among others, is a medication used to treat major depressive disorder, generalized anxiety disorder, fibromyalgia, and neuropathic pain.
And after attempts to change doses and medications, and despite several long attempts, one day it was a surprising surprise.
I praise be to God for your good return. Tell me how life is in European countries. Wow, the wonderful experience. Chess a second life, and educated and conscious people, was one of the best years of my life. I gained wonderful experiences. Happy meeting you. What's wrong with you? You are not okay. Omar is going through a difficult period and was diagnosed with depression and took a lot of antidepressant treatments, but acceptable results did not appear. I have heard of a recently approved drug, and a group of patients of the same age have seen positive results. Really? What's the name of drug? My friend's brother was suffering from severe depression and only got better on a recently approved medication. Esketamine nasal spray may cause side effects: feeling disconnected from yourself, your thoughts, feelings and things around you. Dizziness. Nausea, feeling sleepy. Spinning sensation. Decreased feeling of sensitivity. Numbness, feeling anxious. Lack of energy. Increased blood pressure. Vomiting. Feeling drunk. Feeling very happy or excited. But it is important for you to keep a written list of all of the prescription and non-prescription, over-the-counter medicines you are taking, as well as any products such as vitamins, minerals, or other dietary supplements. You should bring this list with you each time you visit a doctor or if you're admitted to a hospital. It is also important information to carry with you in case of emergencies. What should I avoid while taking Spravato registered trademark? Do not drive, operate machinery, or do anything where you need to be completely alert after taking Spravato. I thank you from my heart. Hello Jane, today my friend told me that there is a treatment for Omar, but the effects of the treatment are high and the method of use is different. I am excited, but I will tell Omar about that after my meeting tomorrow with Dr. Rala. Amira, are you right? You don't know how sad I feel about Omar's situation and his condition. His life has changed. He completed it. He became another person. I'm happy. Dr. Rula, I called you yesterday because my friend told me that there was an approved medication for depression and it gave me hope for Omar.
When you contacted me, I spoke to the doctors and inquired about the medicine and how it should be given, and I received happy news.
The U.S. Food and Drug Administration today approved Spravato Esketamine nasal spray.
Praise be to God. I see you well, Omar, and I congratulate you on the new job.
Hello Jane, really I'm so happy and thankful. When I started using the Spravato nasal spray medication, I almost started to get better.
Omar, how will you take Spravato?
I will take Spravato registered trademark nasal spray myself, under the supervision of a healthcare provider in a healthcare setting. Healthcare provider will show me how to use the Spravato nasal spray device. During and after each use of the Spravato registered trademark nasal spray device, you will be checked by a healthcare provider who will decide when you are ready to leave the healthcare setting. I will need to plan for a caregiver or family member to drive my home after taking Spravato registered trademark. If I miss a Spravato registered trademark treatment, healthcare provider may change the dose and treatment schedule. Some people taking Spravato registered trademark get nausea and vomiting. I should not eat for at least 2 hours before taking Spravato registered trademark and not drink liquids at least 30 minutes before taking Spravato registered trademark. If the patient take a nasal corticosteroid or nasal decongestant medicine, take these medicines at least 1 hour before taking Spravato. I'm happy, smiling face with open mouth.
Proud of you, Omar.
Thanks Amira for everything. Smiling face with smiling eyes. Yes, it's happy end.
We got this idea from the creativity of Dr. Sammy, and he trusted us from your students. Thank you, Dr. Sammy, for everything.
Students working. Hello Jane. Rula. Omar. Amara. And Naya.